So IBS is basically the full form for it is irritable bowel syndrome. It essentially means that your bowel is getting irritated, and whenever the bowel gets irritated, it can have only two things: either it will cause diarrhea or it will lead to constipation. So IBS, the once we called IBS, it is further subdivided into two subgroups: diarrhea predominant and constipation predominant, or a mixed type where both diarrhea as well as constipation can coexist. The important feature of the IBS per se is presence of pain abdomen, which is more bothersome for the patient because it always comes with a pain, and then pain disappears after passing stools, defecation. So basically, for treatment of for management or for further workup of IBS, first we have to be very sure that there is no organic cause for the diarrhea or the constipation, which requires a thorough workup before we label the patient as IBS. Serious issue in the form of day-to-day functioning, it is, because the pain is there, diarrhea is there, so person does not feel good to attend into the social gathering, going to the offices where the paucity of using toilet frequently is there. Otherwise, if you feel that it is a life threatening, answer is no, it is not a life threatening disease, and it can be easily managed. And second part is that is it on increase? Definitely, it is very sharply increasing. Part of the reason is lifestyle and the amount of stress which is present in the present day situations, whether it is office work, whether you are on a road or whatever you are doing. Increased amount of stress plus lifestyle issues lead to IBS. So as I told you that pain is the most important symptom. The other things is stomach. Yeah, pain in the abdomen, which can be right from the epigastrium to lower part, from the upper stomach to the lower stomach. So duration, it is usually a mild to moderate type of a pain, which is bearable. Patient does not usually wince in the pain, but yes, he has a bit of a discomfort. And beauty of this pain is that it gets relieved after passing the stool, whether it's a diarrhea predominant or it is a constipation predominant. The pain usually gets relieved with the passage of a stool. And here the reason, if you look at why this pain disappears or why pain decreases, is basically your bowel is getting irritated. Irritation doesn't mean that a physical irritation is there. It is basically more of a psychological effect on the patients. It can be any type of a psychological trauma or stress, whether it's financial, physical, or mental. This usually leads to the aggravation of all these three symptoms. Okay. And it's slightly more common in women as compared to men, but again, gender is not protective for IBS. Uh, the reason partly is because the level of stress is slightly more on women, because they have to take care of the family, they have to take care of the profession, they have to take care of their day-to-day routine works. That's why slightly stress level is slightly more higher. And as I told you that it is lifestyle plus stress, so it's slightly more common in women, but men are not immune to it. With the lifestyle, I mean lifestyle which has physical activity. So one has to take some time out of their busy schedule to do routine exercises. It might be simple. It might be simple running, cycling, swimming, whatever is accessible. It's not mandatory that you have to hit the gym and do the exercises. Whatever is most easily accessible to you. Walks are okay provided they are brisk walk, and provided there are no other comorbidities, especially involving the heart. So exercise becomes a major basic part. Second is the increased amount of fibers are to be taken. So fibers usually come from raw fruits, that majority of the people do know. But if you are unable to take that amount of the fiber, which is usually lacking in most of the junk foods, that's why it is becoming more common. Because we do not take adequate amount of fibers, we have high stress levels. So, and plus third is sort of a sedentary lifestyle, where we are working, sitting on a table for longish hours without any physical movement. Yes, we do see it in children also, because Children, childhood IBS, which is normally goes to the pediatrics, they do not come directly to us, but it is on the rise for the same factors. That diet is not good, junk food is very high, stress level even in the kids are very high because of the pressure from the parents to perform on specified issues, may it be studies, may it be sports or so. So that leads to increased IBS in children also. As far as yoga and meditation is concerned, we have enough scientific evidence that it helps in IBS management, and the reason is very simple, because most important factor again is stress and lifestyle, especially the sedentary lifestyle and lack of fiber. One part is being taken care of by yoga or meditation, where your mind becomes much better, your mind management becomes much better, leading to better management of IBS. So, in a typical OPD of about 100 patients, if you look at, IBS will be close to about 30 odd patients. So it is not that it is lesser in number; it is pretty decent in number. Okay. And this is the commonest, one of the commonest GI functional disorders, the IBS part. So initially there was a lot of confusion between the IBS and other forms of the functional disorders, but now with the stricter guidelines for IBS, the percentage of IBS will go down to somewhere between 5 to 7% or so, because we have excluded many other diseases or discomforts from the IBS per se. IBS should have pain followed by bowel abnormalities, which can be constipation or diarrhea. Thank you so much, doctor. Thank you. Thanks a lot.